I have been an airline stewardess in the golden age of travel for a long time, and I had a lot of knee injury that was just cumulative, and I was in a dance class here in Bangkok, and whatever I did set it over the edge. So I went to my doctor in Honolulu, and he looked at it and said that I had definitely torn the meniscus and that I needed surgery. They couldn't schedule the surgery for 2 or 3 weeks at the earliest, and since I live in Bangkok, I decided to come back here and do the surgery here. I live very close to Bangkok Hospital, so I'm familiar with the doctors and the departments, and especially the orthopedic department, came very highly recommended. And so I came here to the doctor and the head of orthopedics, who was recommended to me, and he said yes, I definitely needed meniscus surgery, and there was another complication which wasn't even acknowledged by the Honolulu doctor. So I was very happy that I came back here, and they were able to schedule the surgery in about 2 weeks. So I had knee surgery, and it was very successful. My knee is 100%, and it took me, I'd say, 3 or 4 months to recover. The recovery here was easy. I came to rehab and was very supported. I think that Bangkok Hospital is a great hospital, and I would definitely come back. Bangkok Hospital has a real sense of community, from the people that work in the coffee shops to the little restaurants to the people in rehab who you get to know, and the people who push the wheelchairs, the nurses, the doctors. Everyone smiles and acts like they're very interested in what you're there for, and they're very helpful. It's very much a community sense, which I really liked. The doctors here, I think, are very good. I think they are very well educated, and I think that they are on the cutting edge of orthopedics. I think that they came up with options of some other injuries that occurred, which my doctor in the US had not even thought about. I felt when I was in Honolulu that I was at a factory, and this doctor that I saw does meniscus surgery, and so he must see 60 or 70 people all day long. And I felt that the doctor I saw here really listened to my story and suggested I have a few more x-rays and a few more tests. And he decided that not only did I have a meniscus issue, but I had some other issues that he took care of in the surgery, and I think he did an excellent job. He had a great bedside manner. He was relaxed and made me feel comfortable, made my family feel comfortable, and I think it was a very good experience. The Bangkok Hospital staff is very caring. I think everyone went out of their way to make sure I was comfortable, and when they were moving me around to do x-rays or to get information, everybody was very kind. They had small talk. They have an attitude that you don't often see in the US. It's a lot more business as usual there, and I think that Bangkok Hospital and the Thai staff, the nurses, and even the fellows that wheeled you around in your wheelchair are very polite and very kind and very caring. Well, the nurses were lovely, and I think they spoke very good English. I think that it communicated with me, and I could communicate with them quite well, and I was very happy. So happy that I sent my husband here to do surgery too. I went to rehab here for about 6 months in the rehab center, and they had just redone it. And I think that they had great facilities. They had a lot of machinery that a gym would have. They also had a lot of special equipment because I had a knee injury that strengthened your knee. You just kind of laid there and this machine moved your knee back and forth. And it's a very expensive machine, and it really helped. I think that a number of hospitals in the US would not have that kind of machinery available, and I think that the cost of the rehab was really quite reasonable. I was able to see the same rehab specialist every time I went, and he was very caring, and I really got to know the staff. When I came in, after I'd been there a month or so, the girls knew my name, and I brought them little things, and it was like coming to a group of people that were your friends, which was very nice, especially in a situation like rehab. When I was finished, often I'd have to sit in the wheelchair because I wasn't able to walk around yet, and they would make sure I didn't have to wait very long before someone came, and they would say, you know, "Sawadi," and you know, they were just very kind and very caring, and I think I really got to know them, and they got to know me, and I think it was a really good way to recover. I have 2 friends. One's a physician and one's a nurse, and they came to visit me, and I live, as I said, close by. And the doctor wanted to come and see the facility because he had heard a lot about it. He's a physician in Honolulu. we brought him into the coffee shop and we got him a coffee, and then we gave him a little tour of the hospital, and he did sit in the main lobby with his coffee, listening to the classical music, looking at I think it was the storyboard up about what was happening at the hospital that day, and just a little brochure that they gave out talking about the different departments, and he was just so impressed by the whole facility, by the number of restaurants, by the choices, by the music, just by everything. I think that Bangkok Hospital is a world-class operation.